arthritis rates are skyrocketing, as well as the number of knee replacement surgeries. About 600,000 surgeries are performed in the U.S. each year. These surgeries are so common that it seems like everyone who experiences knee arthritis these days anticipates needing a knee replacement at some point in their lives. But how much do we know about these surgeries? What does the procedure entail? What are the possible side effects? And how effective is knee replacement in treating the symptoms of osteoarthritis? First, let's look at what knee replacement surgery entails. The surgery requires the patient to be fully unconscious. The surgeon will open the knee up from the front and amputate the bone above and below the joint. A metal prosthesis is inserted into both the thigh and lower leg bones, with a plastic surface between the two to promote smooth articulation. The surgery typically takes several hours, with the recipient returning to most daily activities in anywhere from a few months to a year. While many patients envision knee replacement like replacing a bad part on their car, the reality of side effects and outcomes is quite different. Some of the more severe side effects of knee replacement are a 200 to 300% increase in the risk for bleeding stomach ulcers, a 3,100% increase in heart attack risk for the 2 weeks after knee replacement surgery, and in 2008, the National Hospital Sampling System indicated that there were 5,000 deaths due to knee replacement in Medicare beneficiaries. There have also been several recent studies showing how knee replacement prostheses shed metal and other wear particles into the surrounding tissue and bloodstream. The long-term effects of these particles are unknown at this point. So now let's look at how effective knee replacement surgeries are. With the procedure being so widely used, you would think that success rates are extremely high. So you might be surprised to learn that the medical community doesn't actually have high levels of scientific evidence that knee replacements are all that effective. In fact, an Oxford University scientist recently commented, long-term data on total knee replacement is largely limited to revision, leaving clinicians and patients in the dark about outcomes such as residual pain and disability. One of the primary symptoms that a knee replacement surgery attempts to alleviate is the patient's level of pain caused by the osteoarthritis. However, a recent study asked surgery patients detailed questions about their levels of pain after knee replacement surgery and found the following. Most patients had levels of pain between 2 out of 10 and 5 out of 10 after their knee was replaced. So while most people considering knee replacement believe that surgery will eliminate their pain, this research indicates that many patients continue to experience significant pain following the surgery. Another recent study indicated that only about half of the patients reported significant improvement after a knee replacement. And for heavier patients receiving knee replacements, a successful recovery is even less likely. Finally, a recent study showed that patients with the most severe arthritis reported the worst outcomes when their knee was replaced.